Sang Wei Neng.
Mr. Speaker, the International Air Transport Association, or IATA, has been working with various countries and regions, including Singapore, to include vaccination certificates in the IATA Travel Pass, or ITP, application. Since 1st May 2021, passengers traveling to Singapore have been able to use the ITP to share their pre-departure PCR test results when checking in with their airlines, as well as on arrival at the immigration checkpoints at Changi Airport. Singapore is also in bilateral discussions with several countries on establishing mechanisms for the mutual recognition of vaccination certificates, including with Australia, Malaysia, and Republic of Korea. We have set up interagency bilateral working groups with these countries and are exchanging information on how we may mutually verify the authenticity of each other's certificates. This includes the exchange of public keys for the verification of digital certificates and the exchange of specimen copies for the verification of physical certificates. These discussions will likely take some time, as countries and regions are at different stages of progress in vaccinating their respective populations. Nonetheless, these multilateral and regional discussions are useful in laying the groundwork for us to reopen travel for vaccinated individuals between Singapore and these countries when we are ready to do so.
Mr. Melvin Yong. Ms. Sang Wei Neng.
Thank you, Speaker, and thank you, SMS, for the comprehensive reply. We understand that we are now in negotiating a lot of travel corridor rather than travel bubble, and one of the important factors is hinges on this vaccine passport. We are glad that we have started this discussion. But having said that, some countries in Asia, especially one country in North Asia, that have experienced vaccination scam. Even a member of parliament were also a victim of this vaccination scam. And different countries have different way of identifying who are the residents who have gone for the vaccination and what type of vaccinations. So my question to the supplementary question SMS is that first, what are the vaccinations, type of vaccination that we recognize in the vaccine passport? And two, how are we going to verify that this vaccination that each of the residents in the different country get are really in the appropriate manner that they are really vaccinated properly? Thank you.
So I thank Mr. Ang for his questions. I think we should view the ITP, the travel pass, and also other forms of such certificates as a two-step process. The first step is how do we establish a way to verify the authenticity of these certificates. So in other words, I need to make sure that when you say that you are tested and it is PCR negative, or when you say that you are vaccinated, that I can trust that this information is accurate. And there's a way to do this. So I think that's the first step, establishing the checks to verify how authentic, how accurate is this information. The second step is once you have this information, then what do you do with it? Now that is a separate discussion, because just because the individual comes from a particular country and has been tested negative or has been vaccinated does not mean that we automatically do away with some of the restrictions, because it really depends on, first of all, what is the rate of infection in that source country, how confident are we of the risk level of this individual when he or she travels to Singapore, and that would then determine what kind of safeguards we put in place. So I think to answer Mr. Ang's questions, this is an ongoing discussion with the countries that I mentioned earlier, but we should view this really as a two-stage process. Thank you.